Hello all, I am Dr. Hema Vaithianathan, Fertility Consultant at Oasis Fertility, Chennai. So today in this session, let's understand more about an important topic, which is secondary infertility. So let's understand more about what is secondary infertility and its causes, how we proceed about testing the couple if they have secondary infertility, and what are the fertility treatments suggested for couples experiencing secondary infertility. So let's start the session. So it's about understanding secondary infertility when a couple is planning for a second pregnancy after they have achieved a previous pregnancy, and if they struggle to conceive for the second time, it is called as secondary infertility. So let's understand more about this as a topic. So infertility in general is like not just when the couple is trying to conceive for a few months and they cannot achieve a pregnancy, then it is not termed as an infertility in that sense. So there is actually a definition for infertility. To diagnose infertility, the couple should have had tried for conception for 12 months, and then to further investigate the couple to call it as an infertility. And there are types of infertility. It is called a primary infertility, as well as there is another type known as a secondary infertility. So in primary infertility, the couple has never achieved a conception before. Whereas in secondary infertility, it happens when a person cannot conceive or carry a pregnancy to term after they have had a successful pregnancy. So this secondary infertility can also be a problem for some couples because they would have had no trouble in achieving conception the first time. But for the second time, if they are trying to conceive, they may be having a delay, and there could be a lot of issues surrounding the problem of secondary infertility. We can understand more about what are the types that can cause this secondary infertility. As a couple, we can understand both the causes, the women as well as in the men. So some of the causes in the women or some of the gynecological conditions, known as the most commonest one being the polycystic ovary syndrome causing anovulation, and then also there is a condition known as premature ovarian insufficiency, in which the level of the anti-ovarian hormone in the AMH is low, and the egg reserve or the egg count gets lower prematurely, and that may be one of the reason there is a regular ovulation and there is trouble in the conception. And then there is endometriosis. So many of you will be knowing this condition, which is a progressive inflammatory gynecological condition that can affect fertility in almost 50% of that has endometriosis. And endometriosis also can cause secondary stage 1 or 2 endometriosis or an advanced stage 3 or stage 4 endometriosis. All of these can progress in a way. It is a progressive disease. So even may not causing a primary infertility, and it may progress. The disease may progress and cause further damage in the reproductive tract and can result in secondary infertility. And the next is pelvic inflammatory disease. Any infection in the reproductive organs, infections in the fallopian tubes and pelvis can result in a sequelae, what is known as the complications of the infection that can result in damage to the reproductive organs in the way that it can cause the blockage, it can cause adhesions or the tissues getting adhered to each other, the normal function, thereby it can impair fertility. And the next is fallopian tubal block, and this can result as a result of pelvic inflammatory disease, or it can result as because of any previous pelvic surgeries, or it can be because of other anatomical differences in the pelvis that can cause fallopian block, which may not be present in the first time during the previous conception, but in the interval time there could be infections, and that can lead to secondary infertility in women. And obviously there could be uterine problems that can cause secondary infertility. For example, if the fibroid, if there is an abnormal location like inside of the uterus, or causing blockage in the tubes, or it is affecting the transport of sperm, it affects the implantation of the embryo, this fibroid also can be a problem. And based on its location and size, it can also lead to secondary. So once a couple is having problem in achieving conception the second time, so there could be so many underlying reasons. So it is important that we do a proper evaluation of the couple in order to identify the underlying reason behind this problem to tailor our treatment based on the underlying condition. So these are, as I mentioned, some of the reasons as to why secondary infertility can happen in a woman once there is no problem in achieving conception the first time. So second is, let's understand more in detail about each of these conditions. So first about polycystic ovary syndrome, as all knowing, it is one of the common gynecological conditions that we see nowadays in all women of all age ranges, from girls to women approaching menopause. This PCOS can be a long-term problem that affects women in all walks of life. So PCOS, and almost 50% of the women that present with infertility as a problem has PCOS. Because polycystic ovary syndrome, the main problem around the PCOS is hormonal imbalance, and that can affect the way the women ovulate, the way the women has regular menstrual cycles. Hence, it can cause infertility in a woman. So polycystic ovary syndrome is a very common condition that can lead to secondary infertility as well because of the anovulation that it can cause. And next condition that is, as I mentioned, is this premature ovarian insufficiency. So premature ovarian insufficiency is when a woman loses or the function of the ovary declines before the age of 40 so that it is shown in the blood hormones, that is the AMH can be low in certain. So it can affect regular ovulation, it can affect the egg quality, it can significantly impair the egg count in a woman, so that it affects the chances of natural consumption. So this can also result both in primary as well as secondary. So the cause for premature ovarian insufficiency or premature menopause can be multiple. The egg count can decline because the woman has had a previous treatment that can affect the egg count, like radiotherapy or before even surgeries in the ovaries can decline the egg count and can result in premature ovarian. And also there are many other autoimmune causes that can lead on to premature ovarian insufficiency. That can lower the AMH levels, that can reduce significantly the egg count in the women and can cause as well. So it needs an evaluation known as an ovarian test, ovarian reserve testing. So by which we can identify the number and the quality of the remaining eggs, so that we can tailor our treatment based on the available ovarian reserve. So such a condition can result, as I mentioned, it can result poor ovarian reserve, so which requires a tailored treatment to address the fertility issues. And next is, as I mentioned, endometriosis is also becoming a common problem in women of all stages of problems. Endometriosis is a very severe inflammatory progressive pelvic disease. It can happen in anywhere in the body, but most commonly it is located, it occurs in the pelvic and in the reproductive organs in women. And endometriosis causes inflammation, so it can cause as a sequelae, it can cause adhesions, it can cause distortion, reproductive organ damage. It can affect significantly the ovary, it can affect the egg quality, it can affect the quantity of the eggs, and also it results in progressive inflammation and the scar tissue formation that thought to be normal anatomy. That way, significantly can affect fertility of the women in multiple ways. Endometriosis also can affect the uterus as well. Adenomyosis that can also affect the uterus in many ways, and it can affect the plantation of the embryo. As I mentioned, genital infection is one of the common reasons because a pelvic infection, especially infection localized to the fallopian tubes, can affect the way the fallopian tube functions, because we need a normal fallopian tube for us to transport the eggs and to transport the sperm, and also the embryos has to be moved from the fallopian tubes where it is formed to the uterus for implantation. So hence any infection in the fallopian tubes can affect the function of the fallopian tubes. It can affect the anatomy of the fallopian tubes. It causes fallopian tubular blockage that way it can result in fertility issues. So this can be identified by investigations. It can be affected by a group, and if this is disease like hydrocephalus can be detected even by so it is important that investigation is done to rule out the genital tract infections and its like fallopian tubal blockage. So fallopian tubal blockage is one of the common causes of secondary infertility. It not just infections, any pelvic surgery issues can all affect fallopian tubes. And the leading bacterial infection is chlamydia infection. It can lead to which can lead to permanent fallopian tubal damage. So any bilateral or the fallopian tube is seriously or severely obstructed on both the sides, then the women may need IVF as a fertility treatment option to start a family. Next, about uterine causes. So uterine diseases, especially progressive diseases like fibroids, adenomyosis, can significantly affect the way the uterus functions. The uterus has to receive the embryos and it has to be very receptive for the embryo for implantation and provide a conducive environment for the embryo to implant. So hence, any of the pathologies or diseases affecting the uterus can significantly affect it, like fibroid uterus, adhesion formation inside of the uterine cavity, or because of a condition known as adenomyosis. All of these can significantly impair the health of the uterus and can present with problems either primary or secondary infertility. Also, some of the uterine problems, congenital uterine anomaly, where because of septum in the uterus, because there are wall-like tissue inside of the uterus, or because of double uterus, or when one of the single side of the uterus is not well formed, all of these different kind of congenital uterine anomalies that a woman can have since birth can also affect the fertility in a way. So these are the common problems that we see in women when they have secondary infertility. Some of the reasons for men, the sperm abnormalities that can result in secondary infertility is also many, like abnormal sperm parameters. When there's some over the age because of aging or because of the occurrence of any new disease like varicocele, men can develop abnormal sperm parameters. They can develop issues with their health of the sperm. So it can affect the sperm health. So that is reflected in a way when the sperm count gets lowered, low sperm count, or the motility or the way the sperm moves can get affected, or the shape abnormality can be there in the sperm. And some of the newly occurring diseases in the men, like because varicocele can affect the health of the sperm, that can result in. Also in men, weight issues like obesity, having high BMI, and excessive smoking and alcohol drinking can all affect the health of the sperm and can result in fertility issues in men. So when a couple present with secondary infertility, we have to do some of the basic fertility testing that we for them. So in order to do a tailored treatment in order to achieve a successful pregnancy. So some of the basic testing that is suggested for a couple presenting a fertility problem is for a woman it is test for ovulation to understand that if the woman is regularly ovulating. Sometimes because even if the woman is having a regular menstrual cycles, she may have problems with her ovulation. So it is important that we document that she is having a regular ovulation by doing an ultrasound where we can check the hormone levels post ovulation. And also another important group of testing is tubal patency testing. This testing is to identify if there is any problems or blockages in the fallopian tubes. This can be done by various procedures. The most commonly done is by an X-ray testing, known as the HSG or the hysterosalpinography. Also, we can do saline sonography by a regular ultrasound. So we can identify and we can decide on the type of testing based on the availability and the patient preference. And next is a regular pelvic transvaginal ultrasound is an important investigation that will help us identify multiple problems that can be there in the pelvic. So transvaginal ultrasound, either a two-dimensional or a three-dimensional ultrasound, will help us identify any of the presenting problems that can result in the fertility problem in women. And also, as I mentioned, ovarian reserve test, that is the AMH testing in the blood, or testing the ovary health by the scan also can help us identify this in women. So these are the basic testings that we plan for a women if she presents with fertility issues. And for the men, the first and the foremost and the most important test that has to be done is the semen analysis test. So semen analysis give us a clue about the health of the sperms, and also to further identify, further decide on the further testing. Also, semen analysis gives us an important insight into what are the further tests has to be done for the female partner um, to address their fertility problems. So once the testing is done and the underlying condition is identified, then we can tailor the treatment based on the couple's needs. So for example, it can be as simple as a treatment like lifestyle modifications can be done, and if their general health is improved, sometimes the couple, if they embark on various lifestyle modifications, a healthy body weight, and take proper healthy diet, and do regular activity in their health, it also can improve their reproductive health. Along with the lifestyle modifications, many couples will take simple basic fertility treatments like ovulation reduction. Or some couples may need an intrauterine insemination cycles, but there are some instances where only IVF or ICSI treatment can help for few couples. So it is not, advanced fertility treatment is not needed for all the couples that is in secondary fertility. So based on the severity of the issues that we identify, for example, a group of couple women, they present with significant tubal issues. If they have both the sides of the tubes, and if they have a severe later stage endometriosis, and if there is severe semen abnormality. So these are the conditions that when the couple will be given IVF or ICSI as an option to build their family. But if there is the underlying problem is correctable, like ovulation issues, or if the woman has only single tubal blockages, ovulation induction and intrauterine insemination treatments can be tried in, um, to resolve their fertility issues and to achieve a success. So I hope this session helped you understand more about secondary infertility. So if you have more questions, please reach to us at Oasis Fertility. So let's end this session here. If there are no questions. Thank you for your patient listening. So I'll see you in your next session.